Topic of tinnitus. I'm really excited to have each and every one of you here and to educate you on the treatment of tinnitus and the options that are out there for each and every one of you. So, just to start, I want to introduce myself. I am Dr. Jules May, an audiologist at Hearing Doctors of New Jersey. I'm originally from Southern New Jersey, close to Philadelphia, and have a background as a competitive figure skater. Throughout my athletic career, I encountered various complex injuries that were often overlooked or met with the assumption that they would resolve on their own, an experience that profoundly shaped my desire to help others. Driven by the belief that no health issues should go unaddressed, I pursued a bachelor's degree in speech language and hearing sciences from Loyola University, Maryland, followed by a doctorate in audiology from Nova Southeastern University, where I graduated as valedictorian. My personal challenges have instilled in me a commitment to patient care, and I am grateful to be in a position where I can make a meaningful impact in the lives of others. So my question to each and every one of you is, why are you here? If you want, you can put it in the chat, or you can keep it to yourself. And any questions you may have throughout this presentation, you may also put in the chat. I will try to address them throughout, if not at the end of this presentation. All right. So what I really want to do today is walk you through what the most proven treatments that help 90% of people who struggle with tinnitus. And then for the extra 10%, what other secondary treatments that we use to help people are. The biggest issue I have found, and you can tell me if I'm wrong, but what I've observed in hearing healthcare is that many people are very confused. They don't know if they need a product like a wristband, a drug, or if they actually need medical treatment. And there's a lot of confusion out there. You get a lot of junk mail, right? As soon as you hit like 58, as soon as you're like more than 51% of gray, they somehow figure it out, and you start getting junk mail about hearing loss. And have any of you gotten a letter in the mail that says, come in and buy a hearing aid, or we'll give you a free turkey for Thanksgiving? And then you'll remember me around Valentine's Day when you get the sweetheart special, buy 3, get 1 for you and your partner, right? So it's really confusing. There's so much junk mail when it comes to hearing and tinnitus. If you search Google, forget it. If you ask Google how to fix tinnitus, you'll find all sorts of wild stuff, right? And then you know what happens. You search Google and then I'm going to scroll the news and then it tracks you. And then every ad you see is going to be about some magic elixir or magic pill to help you with your tinnitus. So just do me a favor and stay away from Google. And then there's questions about how much does it cost? Is it really expensive, right? Prescription hearing technology, which is the only verified recommended treatment for tinnitus. Some people say, but it costs so much money. So you told me maybe I need a hearing aid. Isn't that like $8,000? Look, I'm going to say it now. We're 5 minutes into this talk, and I don't want to mislead anybody. I'm completely transparent. Expect to spend about $2,000 to $2,500 a year on treating your tinnitus. And I guarantee you, it'll be the best money you've ever spent. It will actually change your life. You'll sleep better, live better, reduce your risk of a fall, reduce your risk of cognitive decline and dementia, increase your quality of life, improve your mental acuity and your memory. The benefits of treating tinnitus and hearing loss are unimaginable. That is because you are priceless. But it's good to know what the costs are ahead of time. And if you want to ask me about insurance, look, I said I wouldn't get political, so I'm just going to state a fact. The government has turned a deaf ear to treating hearing loss, no pun intended. They're like, you know what? They signed the legislation a few years ago that says we're going to let you do a DIY treatment. You can, buy it yourself, buy it on Amazon, buy it in a big box store, buy it at Costco, but you're on your own. That hasn't helped anybody. There is nothing that shows that helps anybody. But I'm sure, as we all do, we love Costco. I love Costco, right? But who would go to Costco for a colonoscopy? I don't have any takers. It's aisle 17. It's right in the back. They have a curtain, they pull it over just for the colonoscopy. How could you treat your hearing loss at Costco? And why would you treat your tinnitus? These are major medical conditions. You don't want to go to Costco for these things. Go to Costco for your bulk paper towels, toilet paper, whatever you need. Go to Costco for that. Do not go to Costco for a medical treatment of tinnitus and hearing loss. All right. So what do you think the number one cause of tinnitus is? You could type it in the chat if you think, or I will just answer it for you. So if you live long enough, it's just written in our genetic code, there's nothing you can do about it. So yes, aging is hands down the number one cause for tinnitus. For most people, tinnitus starts in their 50s. For many people, it's actually the first sign of hearing loss. So yes, tinnitus is a symptom of hearing loss. So we get a lot of patients who say, I have some ringing in my ears, but I can hear fine. You don't hear fine, you think you hear fine. You don't notice that your hearing is affected, but tinnitus is actually a symptom, as I mentioned before, of your hearing loss. They're like pretty much one of the same, actually. All right, so let's define tinnitus and what it actually is, right? Most people will say it's the phantom perception of sound. Let's give it the actual medical definition. So here on your left is the ear, and on the other side is the brain. And in the middle, these are all those nerves. I sometimes use the analogy that the nerves are like ropes. So there are all these ropes that connect the ear to the brain. So those are the nerves that connect the ear to the brain. And you can see there's many of them. However, look what has happened from the previous slide to this one. What's different? There's a lot less ropes. There's a lot less nerve connections. There's just less nerves. So nerves, like, think about it, with every passing year, there's more and more nerves that die off from the ear to the brain. It's a natural process that happens. See, we've doubled the lifespan in the last 100 years. And so now we're just starting to figure out exactly what happens to us as we age. And one of the things is, who needs to have the menu far away like this? Where you're holding it out so you can kind of see it, like way out here. That's what happens as you get older or you get glasses, and then you can see better. Exactly. So the sensory systems break down as we get older and we lose connections. So that was number one. There's some that are missing. What else has changed? It's not as bright. It used to be bright and vibrant. Now it's kind of dull. And you notice the brain is kind of dull too. Sound drives brain activity 24/7, 365 days a year. Every single day you're on this earth. Actually, you started hearing 3 months before you even came out of mom. Your brain has been stimulated by sound your entire life. So as you get older, you take away sound, the brain suffers. And not just a little bit, it significantly suffers. And anyway, I'm jumping ahead, but that's part of the reason why hearing loss and tinnitus are linked to cognitive decline and dementia. The brain is literally shutting down. And so, as we talked about earlier, this is progressive. It gets slowly worse over time. It's a degenerative disorder. Hearing loss and tinnitus are the most common neurologic disorders on the planet. So, what are some of the neural consequences of tinnitus and hearing loss? What happens to the brain? As we start to break down the ear and the brain connections, those ropes, as they start to die off, what happens? If you look at this slide, there's the side that's the healthy brain and the side that has tinnitus and hearing loss. There's a clear difference between the two. One is much bigger. The one with tinnitus and hearing loss is much smaller. There's been atrophy to it. This is what happens to our brain over time if we don't do anything about our hearing loss and tinnitus. Okay? So, number one of what happens to our brain when we have these breakdown to our ear and our brain, we begin to experience tinnitus. Now, I'm sure many of you have heard of the term phantom limb. Do any of you know what it is? Maybe, maybe not, but I'll explain it. So when you lose an arm or a leg, but you can still feel it, how does that happen? It makes no sense. It's not there anymore. There's no arm, but you can still feel it. That is what phantom limb is. The textbook definition of tinnitus is the perception of a phantom sound that is not actually there. So as we lose the ear to brain connections, our brain memory says, what happened to that sound? Where did it go? I'm going to make up my own version of the sound. So that sound you're hearing, it's like your brain's check engine light telling you something's wrong, telling you that those connections from ear to brain are breaking down. It is truly an internal alarm telling you to do something. So phantom limb and phantom sounds are actually the same thing. And you know, there are about 10% of people with phantom limb who experience phantom limb pain, which is terrible. Imagine not having a limb, but experiencing excruciating pain in that limb. That's terrible, right? Well, there's about 10% of people with tinnitus who are in excruciating mental pain because they cannot handle how loud the ringing is for them. So the two are very, very, very similar. They're also similar in the way you treat them. Do you know how you treat phantom limb? Well, you basically have to find those broken nerves and you have to stimulate them. And then over time, the brain starts to say, okay, I kind of get it. The arm's not here. And it kind of erases those brain memories. Well, the way you treat tinnitus is by putting sound back into the hearing system. So you're providing sound stimulation to the brain with prescription hearing technology that's meant only for you, for your hearing, or your tinnitus. And then the brain over time will start to ignore the tinnitus. It'll dial that down. It will sometimes get rid of it because it will say, okay, I don't need to make this fake sound anymore. I actually hear real sound now. And that's the best way to help. And it works in about 90% of people. It's not a guarantee, not 100%, but there is very viable treatments for tinnitus by providing sound stimulation through prescription hearing technology. Okay, now the second most common symptom is technically called auditory deprivation, what you call hearing loss or reduced clarity of speech. I'm sure there's many of you who have gone to a noisy restaurant and who struggle to follow a conversation. Like, yeah, it's getting harder. Let's be honest. Is it the restaurant's fault or is it you, right? It's so easy to say, oh man, that restaurant is so loud, I can't hear anything. How is it that everybody else at the table can follow a conversation, but you can't? Maybe the restaurant's loud, but you've been in loud places your entire life and you didn't struggle to follow a conversation. But as you get older, because those ear to brain connections are breaking down, you struggle to hear in noise. And there's actually been a number of research articles that I've looked at where people who have tinnitus, when you test their hearing, it looks pretty normal, but they struggle to hear in background noise. So tinnitus and difficulty hearing in background noise come together. Have you ever thought, I hear you talking, but don't understand what you're saying? I know you're talking, but I'm missing the details. That's that lack of clarity. Old-fashioned traditional hearing aids make things louder. People with tinnitus and hearing loss don't typically have a volume problem, they have a clarity problem, and we can fix that. Here's another one. Can't hear in background noise? I'm going to give you a simple number. You need 90%, I'm going to repeat that, 90% of ear to brain connections to separate speech from what you want to hear in background noise. Once you have early stage hearing loss, you've already lost 50 to 70% of the ear to brain connections. So you just aren't going to hear well in background noise. You need technology that can overcome the problem and clean up the signal, reduce the background noise, and pump in the speech. We can do that. And now, the third most common symptom as the ear to brain connections break down is cognitive decline. So what typically starts as word finding, like clicker, pen, a waitress's name, does that happen, right? When you put so much effort into hearing, you don't have enough leftover energy for memory storage. It's a real simple equation. So if you don't hear well, if you have tinnitus and put a lot of effort into listening to what I'm saying, hi, my name is Jules, I'll be your waiter. What can I get you to drink? Your brain is like, I just have to, all I can think about is what the person said, what drink I want, but I don't have any extra effort to actually store that memory. So these are very, very, very common, right? There was, I don't want to totally geek out on you, but there was another paper that came out recently that says unequivocally, the more hearing loss and tinnitus you have, the more likely you are to develop cognitive decline and dementia. It is like almost every week, 2, 3 times a month, another scientific paper comes out that says hearing loss and tinnitus are closely tied to cognitive decline. So for many of our patients, they say, I have these issues. So guess what? One of the first things when you come to Hearing Doctors of New Jersey that we will do is a cognitive screening. We want to know where your memory's at. How are we able to process? We want to know if there's any red flags. We will communicate with your primary care doctor if there's any issue. If you come to us, you've got hearing loss or tinnitus, you are at an increased risk. I want to understand your risk and I want to help you reduce that risk. That's my job. That's our job. Okay? So, what does this have to do with dementia? right? Well, what do these two things have to do with each other? Basically, I'll go through this quickly. The brain physically changes with tinnitus. The way the brain operates physiologically changes with tinnitus. And the brain functionally changes with tinnitus. So there's a bunch of science behind all of this, right? Like there's an article that came out and said the cells inside the brain, they start to change. They change their shape and the way they operate, all because of tinnitus. There's another few articles that came out and they actually looked at how the brain activates. They looked at all different parts of the brain and they found in people with tinnitus, the areas in red have increased activity. What are these areas in red? All of these areas in red have to do with emotion, the limbic system, the way we respond to things, anxiety levels, sleep deprivation. All these areas are much more active. Heart rate, all these areas are much more active. And then there's the areas in blue. Well, they all have decreased activity. This is where we make decisions. This is also where we store memory. So the brain actually changes with tinnitus. And then there was a study that looked at functional changes. So how well do people perform on cognitive tests? Does the brain change? Does the memory change? I'll make it really short and sweet. So this paper that just came out this year looked at 62,000 people. That is a lot. That is a large number of people. And if you know anything about scientific research, getting that number of people is astronomical. It is crazy. And that's just also a really big study. You don't see that often. They found that tinnitus is strongly associated with an increased risk of cognitive impairment, including dementia. And the largest effect was in adults 60 years and older. But something to look, to even think about for the next few years, right? But this is really important. We can't ignore this data. Part of the reason I do this is because I feel like I want to empower you to make the decision of, you know what, I've got 10. I don't hear great. I have to do something about this. I can't just keep ignoring it. I can't hide behind a $2,500 a year bill and say it's not worth it. I can't sit at home and say, well, my doctor said there's nothing I can do. No, there is something you can do. And it's really important you do it because if you don't, you might be one of these statistics. You might not. It's like Russian roulette. I don't know. But do the best thing you can for you and do something. So we've known these connections of hearing loss and tinnitus and cognitive decline for many years. There's been a lot of research out of Johns Hopkins, a very, very reputable source. And this one goes all the way back to 2011. And basically, all their research said, it's up here on the screen, even if you have mild hearing loss, it's a major problem because even a mild hearing loss, which I don't even like to use that word because if you think mild, it's not a big deal. Imagine a doctor saying you've got mild cancer. You never hear that. So what does that even mean? It's not that bad, probably, right? So I really don't like to use the word mild because people often associate with it's okay, it's just mild. If you come to Hearing Doctors of New Jersey, we will stage your hearing loss just like every other major medical disorder stages, 0 through 4. So even a mild hearing loss increases your risk of developing dementia by 200%. What's really troublesome is that most people that we test for the first time are usually somewhere around 300% increased risk. They've been in denial for 10 years or more. And so we first see them around 3 to 500% increased risk. We want to give you as early as possible to start doing something. Catch it early and treat it early. That's our basic philosophy here at Hearing Doctors of New Jersey. Use it or lose it. The sooner you start something, the better the prognosis will be. Okay, so this is a quote by Dr. Bredson. Everyone knows someone who is a cancer survivor. Nobody knows anyone who is an Alzheimer's survivor. Look, dementia is scary, and I'm not here to scare anyone. But I'm sure some of you know someone who has been diagnosed with dementia. It's a terrible, terrible disease. Something you don't ever want to watch somebody go through. And even myself, with my grandfather who has Parkinson's, he's now experiencing Parkinsonian dementia. And that is in itself hard to watch. Doing the right things for yourself to prevent decline is only going to give you the best outcomes so you can continue to actively live your life. Now, there are many different types of dementia. As I mentioned, Parkinsonian dementia is a thing, and it's actually an umbrella term, dementia. That's why you often see a picture of an umbrella. There's Alzheimer's, we all know that one. There's vascular, that's related to heart issues and blood clots that block oxygen getting to the brain. Lewy body, if you all remember Robin Williams, the comedian, so you know he committed suicide, right? Yeah, he committed suicide because he was diagnosed with Lewy body dementia. He believed, right or wrong, he believed he caused his dementia with all of his drug use, and so he couldn't live with that. He couldn't live with putting his family through it. And I'm sure we all know Bruce Willis, Die Hard. He has frontotemporal dementia. They say there's as many as 200 types of dementia. These are just the big ones. And have you ever known anyone with early onset dementia? This is probably some of the worst. It's terrible. Tinnitus can actually be associated with early onset dementia. Once again, not here to scare you, but if you find this stuff scary, I'm with you. It is scary. This is some scary stuff. But my job is to educate and motivate you to treat your tinnitus, to treat your hearing loss, to give you every opportunity to prevent decline. So when it comes to treating tinnitus and hearing loss, right? I ask a hypothetical question of what you would want it to look like. I believe treating tinnitus should be simple. It should be something you don't have to think a lot about. You don't have to worry about. It should just become part of your everyday. They used to be devices you put in your ears and they made noises and you pushed buttons and there was like background noise and there was a wind program and you could add in white noise and it was complicated. It was too much. And all it did was distract you from the actual ringing in your ears. Not trying to just distract or trying to treat. So it should be also affordable, right? Obviously, everybody's definition of affordable is different depending on your own wallet or your own circumstances. But again, expect to budget around $2,500 a year to effectively treat your tinnitus. Notice I said effectively. You want to spend $1,000 and not have a guarantee, then I don't have a guarantee for you that that doesn't fall into an effective treatment category. You can't skip out on yourself. You can't cut corners when it comes to a major medical condition like tinnitus and hearing loss. It better be proven. The reason I keep spouting about all these different scientific facts to you is because I want you to know everything that we do here is driven by science. And it's guaranteed. At Hearing Doctors of New Jersey, we guarantee our treatment program. It's that simple. I don't want your money if treatment doesn't work. Okay? It's not that reasonable. A lot of doctors will yell at me for that. How could you do that? You can't guarantee it's not going to work. So I'm telling you, we guarantee our services, our treatment programs. And if it's not for you, we shake hands as friends, and that's okay too. That's why when we guarantee it, and if not, we're going to find you the help that you need. We're going to do everything we can, but I don't want to nickel and dime you if it doesn't work. That doesn't make sense to me. Okay. All right. So this one will be a little quicker, but what treatments aren't recommended? And this is also what can drive me a little crazy is that so many people have the doctors say, oh, there's nothing you can do. So many people come to see me that tell me that. And it's horrible because that drives people down a rabbit hole of Google. So let me tell you what's not recommended. And this is the American Academy of Otolaryngology Head and Neck Surgery. In layperson world, this is the organization that all your ENTs belong to. Okay. This is like a branch of the American Medical Association devoted specifically to head, neck, hearing, and tinnitus. This is their clinical guidelines. I'm not going to give you an opinion on anything. I'm not going to tell you the facts of what does not treat tinnitus, but there is no medication, no surgery, no brain stimulation, electrical stimulation, acupuncture, or supplements that have been proven to effectively reduce tinnitus, with one exception, melatonin. And why is that? Well, helps you sleep better. And when you sleep better, you're less anxious, you're less tired, you're less stressed, which can ultimately help with tinnitus. Because guess what? What triggers tinnitus or makes it seem like it is louder? Stress, sleep deprivation, anxiety. So melatonin doesn't actually fix the tinnitus, but it does help you sleep better. And we'll tell patients all the time, look, if sleep is the worst part of your day, when the tinnitus is really loud, about 30 minutes before you go to bed, take a melatonin. It helps a lot of people because it addresses sleep hygiene, which reduces tinnitus. Oh, and sound machines, right? A lot of people will say this one can drive me crazy too. My doctor told me to get a fan. My doctor told me to sleep with the TV on. And here's my favorite. My doctor told me to become friends with my tinnitus. Name it, talk to it, embrace it. Ringing Ronald. I don't know what to call him. Tin Tom. I don't know. But I've heard all of these, right? Sound machines, yes, maybe they'll distract you and help you fall asleep, but they don't actually address the underlying condition. So medication and surgery, all of that, none of that is directly doing anything to help your tinnitus and hearing loss. So when it comes to what treatment is recommended, I'm going to break this into direct versus indirect or secondary treatments, and I'll explain all of that. The only direct treatment that directly stimulates the brain and reduces tinnitus is prescription hearing technology. If you'd like to read the guide, it's about 40 pages. It's an absurd amount of medical jargon, but it is the most thorough guide on how to treat tinnitus. So when an ENT says there's nothing you can do, I want to like airdrop 1,000 copies to their house. But yes, there are things you can do. It's been recommended. It's recommended by their association. Prescription hearing technology is the only proven way to directly reduce tinnitus. Now, the other one is cognitive behavioral therapy, or CBT. But it's kind of like where the doctors told you to become friends with your tinnitus, relaxation, breathing exercises, all those things can be good. Reducing stress, increasing sleep, all those things are good, but it falls in the indirect category. because it's not directly fixing the tinnitus. It helps your emotional response to the tinnitus. Similar, that's pretty much what CBT is doing. It's reducing your emotional response specifically to the tinnitus, but it's not directly treating and reducing the tinnitus. So that is our difference between direct and indirect treatment for tinnitus. Okay. So my recommendation is that you always want to directly treat the tinnitus. And then, if needed, for that remaining 10% of people that might just need a little bit more help, it happens, I've seen it, then we can talk about melatonin and sleep. And let's talk about all the other secondary options that we can help you with. If we do need to address sleep hygiene, we've got a whole handout on that. Breathing exercises, that's another one that's there. Linear is always an option if things just aren't getting any better. And tinnitus retraining therapy, which uses still some kind of sound hearing technology with reducing that emotional response. So all of these things are options after you directly treat the tinnitus. I'm going to emphasize after, because none of these things are going to work if you don't directly treat the problem. Once you directly treat it, if we need to insert some of these, that is 1000% an option. But we got to do the first step first, which is treat the tinnitus directly. All right, so let's just recap the 4 major benefits of treating tinnitus and hearing loss. And the first one is to restore confidence. We always want to restore confidence in patients. When we have tinnitus and hearing loss, it tends to make people withdraw, or it frustrates people, or they can't stop talking about it, or they think that they have a problem and they can't do anything about it because so many doctors have said, you can't do anything about it. Just by treating it and making something much more reduced for you and making you as a whole calmer and more relaxed will just restore your confidence, make you want to get back out in the world, not have you so focused on this annoying ringing in your ears because you're doing something about it. That's half the battle. Just doing something about it and becoming more confident in yourself. I actually recently had a patient who suffered with tinnitus. We directly treated her tinnitus with prescription hearing technology, and within that first week, the confidence you could see in this individual was astronomical. It's why I love to do what I do, is to see these changes in people. Remaining independent, it's another big one. Treating tinnitus has been shown to help people stay in their home longer. It reduces the risk of a fall. People who treat their tinnitus and hearing loss live longer. So those who go without are about 24% more likely to suffer from premature death. I haven't found anything worse than death, right? That's it. That's the end. It said in the paper, those who treat their hearing loss with prescription hearing technology live longer. So do it. Don't hold back on yourself. Do this for yourself. And stopping the decline. You can see, again, in this photo, there's the normal brain lit up like a Christmas tree. Then you have somebody that has mild cognitive impairment, so a little less lit up. And then you have the brain of somebody who suffered from Alzheimer's disease. There is a lot of empty space there. Just treating the tinnitus and hearing loss can actually slow, if not stop, this process from happening. So again, just do it. It's like Nike always said. Okay. And look at on the bright side, it's also going to improve your memory. So treat your tinnitus, treat your hearing loss, and you're sharper. You'll respond quicker. You can remember better, hear better in background noise. There's all sorts of good things that can come from it. So why not go for it? And the other big one is reducing the risk of falling. The more tinnitus, the more likely you are to fall. Reduce your tinnitus, the less likely you are to fall. As we age, falling becomes much more detrimental. I mean, when I fall, I get up. But 60, 70 years from now, I fall, I break a hip, gonna be a lot harder, much more traumatic. So treating the tinnitus will make you less likely to have a traumatic fall. So again, do that. Treat the tinnitus. So I wanted to share this because this is one of our many 5-star Google reviews from a young guy in his 50s, and it talks about how treating his tinnitus has completely changed his life, changed his relationship with his family, his other relationships, and he's one of our recent patients. I was able to help stop struggling with his tinnitus. And again, it's not an overnight thing. It is a treatment. It takes time. But for this individual, he was willing and wanted to do this for himself. And you can just see how far he came and how happy he was once he made that first step. So you can do it too. So in the last decade, there were 34 studies that looked at treating tinnitus with prescription hearing technology. 100% of those studies found a positive effect. There wasn't a single dissenting medical research outcome, not a single paper that said prescription hearing technology doesn't work. 34 out of 34 in the last 10 years have been proven that prescription hearing technology results in less ringing, better focus, better sleep, and less stress. And of course, the big one here, reducing the risk of dementia. As we talked about earlier, we don't want to see anyone that has to either themselves or see someone else suffer with dementia. It is a sad thing. You just start to lose someone entirely. And just by taking this first step of directly treating your tinnitus and hearing loss can help reduce this risk. It's a modifiable risk factor. So just do something. And you are just putting yourself in a better position for down the line. And this is also important. Nearly half of all cases of dementia are considered preventable. And of the list of 14 things you can do that's on the screen right now, it's right there at the top. Treating your hearing loss and tinnitus is number one. Everybody thinks they should exercise more, right? Well, exercise is pretty much all the way at the bottom. Treating hearing loss is nearly 4 times as important as physical exercise. Reducing hypertension. It's almost 4 times more important to treat hearing loss. Vision impairment. Everybody who can't see gets glasses, but people who can't hear do nothing about it. And it blows my mind because very similar. You have to go to the eye doctor every year to check your eyes and potentially get a new prescription. Hearing loss is just as, it's actually more important. And it's the same thing with prescription. You have to update prescriptions. You have to do routine follow-ups in order to make sure we're monitoring things because these sensory things change over time and they're only going to decline. So we need to stay on top of it so that we're always addressing the ringing, we're always addressing the hearing, and we're always preventing decline. And so our commitment to every patient is that when you sign off here today, if you haven't already done so, please take the next step. Begin your treatment journey as soon as possible. Don't wait. At our practice, we provide the most comprehensive diagnostic program. We will go through a rigorous cognitive screening process. We do provide low monthly payments because we have to make it affordable. Everything, emphasizing everything you need is included. Wherever you need to hear, we will address that for you. TV, anything you need, supplies, anything you need. We never nickel and dime our patients. I don't believe in that. Everything is included. All your follow-up visits, all your exams, your cognitive screenings, your annual evaluations, every single thing is included. I can't just have you start treatment and then send you out on your own, which is why you can't just buy hearing aids over the counter and expect a decent outcome. Any study that looks at buying hearing aids off the shelf has proven that it does not work, because tinnitus and hearing loss is a chronic neurologic disorder, needs to be monitored over time. And the other part is what we do at our practice. If anything happens, you have a full lifetime warranty. So if something breaks, your hearing changes, whatever it is, you are covered, and we guarantee our results. And I guarantee to you that within the first month and a half, if you are not seeing a reduction in your tinnitus and you are not hearing great again, we will part ways as friends. And that is not a problem. And here is one of the best things. Your tinnitus and hearing loss are a progressive degenerative disorder, which means that your tinnitus, hearing, and cognitive needs will change over time. And that means that we will need to change your prescription over time too, just like people do with glasses. When we make changes to your prescription, nothing changes. There's no additional cost to change your treatment, which happens approximately every 4 years. That is our commitment to you. That is why we are one of the highest rated hearing healthcare practices in the state of New Jersey. And none of this would be possible without my amazing team. So I'll leave you with this, and then I'll stick around with any questions that people might have. So our promise is we treat every patient. We have our guarantee. We have a comprehensive diagnostic program. I already told you. First thing we're going to do is a cognitive screening. Then we're going to put you through the rigors. Leave no stone unturned. I'm going to tell you exactly why you have tinnitus, exactly where it's coming from, and exactly what we can do to effectively treat it. We have our low monthly payment program. Everything's included. Seriously, nobody ever gets nickeled and dimed at Hearing Doctors of New Jersey. We do not believe in that. We believe in an all-inclusive premium hearing healthcare that's simple. All your follow-up visits, annual exams, full lifetime warranty, guaranteed results. When it comes to treating tinnitus and hearing loss, all the science tells us about every 4 years, we need to update your prescription. It's that simple. This is part of the expectation. If you've got tinnitus and hearing loss, now our job is to slow the progression, to help you hear better and live with less ringing. But it isn't going to go away. We're not curing it. You'll be under our care until the end, whenever that may be, another 20, 30, 40 years. Who knows how long, right? But ultimately, our goal is we know that aging is inevitable, but decline is optional. But which do you choose, right? That's what it's all about. What are you going to do for yourself in your life to prevent decline? Thank you so much, everyone, for attending today. If you do have any questions, please throw them in the chat and I will take a look at it. And if you see in the chat, there is a link and you can schedule a free 15-minute phone consultation with me where you can tell me about what you've been going through, and I will give you all kinds of information as well. So if you're interested in scheduling that free 15-minute consultation, click on the link in the chat. And I think you'll also receive an email that might have it as well, but definitely copy and paste that link or click on it directly, and then you can schedule something. All right. So good afternoon, everybody, and welcome to my second webinar regarding the